Wrist arthritis is very common and it's a complex process because wrist arthritis oftentimes doesn't develop just because somebody gets wrist arthritis. Oftentimes it's the result of a remote injury that somebody had and never treated it and just toughed it out, and then they come in maybe 15 or 20 years later even with a worn out wrist joint. There's a lot of options we can use to treat it, the same way that we would treat a knee or a hip arthritis to start out with some therapy, some bracing, and maybe some injections. When that doesn't work, there are a lot of surgical options, which are pretty involved. The surgical options for wrist arthritis range from just trimming off some bone that's rubbing on other bone to help people feel better, to actually removing a whole row of bones, which helps people get some motion back after surgery. And also fusing the wrist sometimes has to happen. That's very good for pain relief, but it leaves people with a stiff wrist. There are some good newer options that have a lot of promising data behind them, some resurfacing wrist options that are in the works but are not yet really done all that routinely. So there are a lot of options, but it depends on what pattern of arthritis people have to get them feeling better.